Digital rectal examination and anoscopy. Definition: a digital rectal exam is a test for both men and women. It allows a doctor to check the lower rectum, pelvis, and lower stomach for cancer and other medical problems, including prostate cancer in men.
An anoscopy is an examination using a small, rigid, tubular instrument called an anoscope, also called an anal speculum. This is inserted a few inches into the anus in order to evaluate problems of the anal canal. Anoscopy is used to diagnose hemorrhoids, anal fissures, tears in the lining of the anus, and some cancers. This test is usually done in a doctor's office. The patient is required to remove their underwear, and must either lie on their side on top of an examining table, with their knees bent up towards the chest, or bend forward over the table. The anoscope is 3 to 4 inches long and the width of an average to large bowel movement. The doctor will coat the anoscope with a lubricant and then gently push it into the anus and rectum. The doctor may ask the patient to bear down or push as if he/she were going to have a bowel movement, and then relax. This helps the doctor insert the anoscope more easily and identify any bulges along the lining of the rectum. By shining a light into this tube, the doctor will have a clear view of the lining of the lower rectum and anus. The anoscope is pulled out slowly once the test is finished. The patient will feel pressure during the examination, and the anoscope will make one feel as if he or she were about to have a bowel movement. This is normal, however, and many patients do not feel pain from anoscopy.
Application in medicine. How the test is performed. The procedure is usually done in a doctor's office. A digital rectal exam is done first. Then a lubricated instrument called an anoscope is placed a few inches or centimeters into the rectum. When this is done, you will feel some discomfort. The anoscope has a light on the end so the healthcare provider can see the entire area. If necessary, a sample can be taken for biopsy. This test can be used to determine if you have anal fissures, anal polyps, foreign objects in the anus, hemorrhoids, infections, inflammation, and tumors. Pros and cons. Pros. It is used to detect if there is any disease in the inner part of the anus, the final area of the colon called the rectum. Cons. Common and high-resolution anoscopy have very few risks. You may feel some discomfort during the procedure. You may also feel a small pinch if you have a biopsy taken. Also, you may have some bleeding when the anoscope is removed, especially if the person has hemorrhoids.
Hello, I am Dr. M.R. Rajshekhar. I am a general surgeon and coloproctologist practicing at Chirag Hospital and Institute of Proctology for the past 20 years in JP Nagar, Bangalore. Anoscopy. In scopy, it means that we are looking into an organ using a small instrument. So anoscopy is using an instrument to look into the anal canal and part of the rectum. That can be done manually or using a camera, which is a preferable mode of doing it, because we can record it, enlarge it, see it and take a printout. So we do what is called a video anoscopy or video rectoscopy to confirm the diagnosis, record it, and for future purpose also it will be useful. That is what is called anoscopy. The rectal symptoms for which a person should contact a proctologist is any symptom in the rectum, especially if it is pain, bleeding or any swelling in or around the anal canal, which is lasting for more than 3 days, or which is repeating again and again, or which has already been treated by a general practitioner or some other doctor. So they definitely require an anoscopy and a proctologist consultation to exclude major issues and also to treat any regular diseases like piles, fissures and fistulas at an early stage where they can get the best benefits.
Issue applied in Ecuador. In 2017, 4,292 new cancer cases were detected in the Sulca matrix. Of the total, 18.3% corresponds to the prostate. According to the International Agency for the Research on Cancer, estimates a total of 3,642 cases of prostate cancer have been diagnosed in Ecuador in the last 5 years, which represents 33% of all cancer cases in men. Conclusion. In conclusion, the anus is the opening of the digestive tract through which stool leaves the body. The rectum is the section of the digestive tract that is before the anus. It is where stool is retained before it leaves the body. Anoscopy can help you, healthcare provider, find problems in the anus and rectum, such as hemorrhoids, fissures, and abnormal growth.